Ophthalmoscopy is a test that allows a health professional to see inside the fundus of the eye and other structures using an ophthalmoscope. It is done as part of an eye examination and may be done as part of a routine physical examination. It is crucial in determining the health of the retina, optic disc, and vitreous humor. To begin the ophthalmoscopy exam, prepare the ophthalmoscope, the patient, and the setting for an ideal exam. First step, it is usually best to remove your own eyeglasses for the exam, unless the patient's refractive errors make it difficult to focus on the retina. Step 2. After darkening the room, turn on the ophthalmoscope and shine the light on your hand or on the wall. Step 3. Turn the lens disc until the largest white circle of the light can be seen, and the diopter indicator reads 0. Meaning, the ophthalmoscope lens is neither converging nor dispersing the light. Step 4. Keep your index finger on the lens disc during the exam so that diopters can be adjusted as necessary to focus in on the retinal structures. Step 5. To examine the patient's right eye, hold the ophthalmoscope in your right hand and look through the aperture with your right eye. To examine the patient's left eye, hold the ophthalmoscope in your left hand and look through the aperture with your left eye. This avoids bumping noses with the patient. Step 6. Position yourself about a foot from the patient at eye level and ask the patient to stare at the spot on the wall just over your shoulder. As you peer through the aperture, keep both eyes open. Press the ophthalmoscope firmly against your bony orbit and hold the handle at a slight angle away from the patient's face. Step 8. Position the ophthalmoscope about 15 degrees angle lateral to the patient's line of vision. Direct the light to the pupil and look for an orange-red glow. This is the red reflex. Note any opacity that seems to interfere. Step 9. Stay focused on the red reflex and move the ophthalmoscope inward along the 15 degrees line until you are almost on top of the patient's eye. While doing this, the retinal vessel should come into sharp focus.
Look for a retinal blood vessel. You'll be quite zoomed in on the retina, but you should be able to find a blood vessel. This will look like a red vessel on a yellow-orange background. Move your head and follow the vessel as it joins other vessels until you come to the optic nerve head. Usually, you have to move towards your patient's nose in order to find the nerve. This will depend on the angle you use when you start your approach. If you see the vessel branching into more vessels, you're going in the wrong direction. Move the other way. As you follow the vessel, try to appreciate details of the arteries and veins. Can you see any arteriovenous nicking or copper wiring? Do you see any hemorrhages or cotton wool spots near the vessels? When you see the optic nerve, try to appreciate some of its characteristics. Are the edges crisp and well-defined or blurry from optic nerve edema? Are there any hemorrhages? What is the cup-to-disc ratio? The last thing you can look at is the macula. You can do this by moving directly into the line of sight of your patient or asking your patient to look directly into the light.
If the image is lost while searching the retina, it means the light fell out of the pupil as the ophthalmoscope was moved. It takes some practice to keep it inside. In summary, the ophthalmologic exam is probably the most challenging for students to master. With time, however, it becomes routine. It is also one of the most productive parts of the physical exam, as it not only offers a window into the condition of the eye, but also provides evidence of disease elsewhere in the body.